Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about chronic kidney disease, or CKD. It's one of those conditions many people have heard of but don't always understand. And the tricky part is that many people can live with it for years without knowing. So let's start simple. When doctors say chronic kidney disease, what does that really mean?
At its core, chronic kidney disease means the kidneys are not working as well as they should, and this problem develops over time. Normally, the kidneys quietly filter waste, balance fluids, and help control blood pressure. When that filtering ability slowly declines and doesn't fully recover, we call it chronic kidney disease.
A lot of viewers are surprised when they hear how common CKD actually is. Is it really that widespread?
Yes, it is. In the United States, about 1 in 7 adults has chronic kidney disease. That's roughly 37 million people. What's more concerning is that most people don't know they have it, even some with more advanced disease.
Why does it go unnoticed for so long?
Because early CKD usually doesn't cause obvious symptoms. People often feel fine at first. As kidney function worsens, they might start noticing tiredness, swelling in the legs or face, changes in urination, poor appetite, nausea, itchy skin, or trouble concentrating. By then, kidney damage may already be significant.
What usually causes chronic kidney disease in the first place?
The two most common causes are diabetes and high blood pressure. Over time, both can damage the delicate filters inside the kidneys. Other causes include chronic kidney inflammation, inherited kidney problems, repeated infections, autoimmune diseases, and long-term use of certain medications. Often, it's not just one cause, but a combination over many years.
So, when a doctor suspects CKD, how do they confirm it?
It usually starts with basic blood and urine tests. Blood tests estimate how well the kidneys are filtering. Urine tests look for protein leakage, which is an early warning sign. Blood pressure checks and imaging may also help. Importantly, CKD is diagnosed over time, not from a single abnormal test.
People often hear about stages of CKD and feel worried. How do doctors use these stages?
The stages help us understand how much kidney function remains. They're based mainly on estimated filtration rate and how much protein appears in the urine. Early stages mean damage is present, but function is still relatively preserved. Later stages reflect more severe loss. Stage 5 means the kidneys can no longer support the body without replacement therapy.
That brings up an important point. When does treatment make the biggest difference?
Early, before symptoms appear. That's the golden time. When we detect CKD early, we can slow progression, protect remaining kidney function, and prevent complications long before dialysis is needed.
Many patients ask a very direct question. Can kidney damage be reversed with medication?
That's an honest and important question. Right now, we don't have medicines that can fully repair damaged kidney tissue, but we do have treatments that slow damage and protect what's left. Controlling blood pressure is critical. Some newer diabetes medicines also protect the kidneys. Treating anemia, bone problems, and acid buildup further reduces kidney stress. Starting treatment early truly changes the trajectory.
Before dialysis even enters the conversation, are there conditions that look like CKD but aren't actually chronic disease?
Yes, temporary problems like dehydration, acute kidney injury, urinary blockage, or medication-related stress can look similar at first. That's why careful evaluation and follow-up are so important.
Dialysis is something many people fear. When does someone actually need hemodialysis?
Dialysis isn't started just because a number crosses a line. It's considered when kidney function is very low and the body can't maintain balance anymore. That may show up as fluid overload, breathing difficulty, severe electrolyte changes, severe fatigue, confusion, or toxin buildup. The goal is to start at the right time, not too early and not too late.
For patients with advanced CKD, diet often becomes a daily concern. What usually needs attention in stage 5 disease?
At that stage, the kidneys struggle to handle certain minerals. Foods high in potassium and phosphorus often need to be limited. Salt intake should be reduced to control blood pressure and fluid retention. Protein intake may also need adjustment. This is where working closely with a renal dietitian really helps.
Beyond food and medicine, what does daily life support look like for someone living with CKD?
Lifestyle care plays a big role. That includes monitoring blood pressure and blood sugar, staying physically active within limits, getting enough rest, managing stress, and avoiding smoking. It's also important to avoid over-the-counter pain medicines that can harm the kidneys. These steps protect both kidney and heart health.
Infections can be serious for CKD patients. Do vaccines matter here?
They matter a lot. People with CKD are more vulnerable to infections. Vaccines for flu, pneumonia, hepatitis B, and COVID-19 help prevent illnesses that could accelerate kidney decline or lead to hospitalization.
Many people think CKD care is only about seeing a nephrologist. Is that enough?
Usually no. CKD care works best as a team. Primary care doctors, cardiologists, endocrinologists, dietitians, mental health professionals, and sometimes obstetric specialists all play a role. This team approach improves both outcomes and quality of life.
Before we finish, what's the key message you want people to take away?
Chronic kidney disease is common and often silent, but it's not hopeless. We may not cure it, but we can slow it down, reduce complications, delay dialysis, and help people live fuller lives. Early detection and consistent care make a real difference.
Thank you for that clear and practical explanation. And thank you for trusting Dr. Health Hub. Remember, your health is your wealth. Stay tuned for the next doctor tip you can trust.